Hi, my name is Gifty, and my client is a 68-year-old male who is recovering at home after a stay in the rehabilitation ward after a stroke. Now, essentially, my client will be learning about all aspects of having a stroke, but for these learning sessions in particular, we'll be talking about blood pressure and how it contributes to a stroke. Firstly, before any teaching, I will be holding a discussion with the client and his wife about what their prior knowledge that and also what they want to get out of the session, because that's important to what they want to know, especially so you can address any particular issues directly. And also it gives the facilitator an opportunity to identify any knowledge gaps between the pair and plan accordingly. Um, Discussion is a great method for building on knowledge from information and past experiences. Discussions are greatest when all participants are actively involved and when the teaching group is larger. Um, the main learning outcome of this learning session in particular is to successfully take a blood pressure, obviously, a blood pressure test, and why taking a blood pressure test is so important. And by building on um, knowledge, this will increase the client's understanding and thus eradicating any feelings of stress, fear, or anxiety for the client and his wife. Um, uh, by the end of the session, the client should be able to successfully take a blood pressure. This would save time. Instead of going to the GP, the client would know how to record their own blood pressure. And the client should also be able to understand the background of high blood pressure and its risk factors. This way, the client is able to understand the levels that are within and out of healthy range, and this would save a lot of trips, unnecessary trips to the hospital. Um, the client will also be able to manage their blood pressures effectively, thus also lowering any risk factors so that another stroke does not occur. And this session will ensure that the client is able to obtain the best quality of life regardless of his health condition. And after the learning session, the client and his wife will be able to reflect and reiterate and consolidate all their knowledge. And they can also give feedback on how the session went, which is a good reflection for the facilitator for future practices. And thank you.